they had a wonderful program called Know Us Before You Need Us, and I use that all the time. I want everyone in the community to know about what we do and the services that we offer, and before it comes to a crisis point. At a crisis point, things are really confusing and hard to understand and time sensitive. We want you to know about us and know about the services long before you're at that crisis point. So I think that was your leadership group. The one, no, not yours. I know it was one of them. We do a wonderful leadership academy here that helps our employees be sure that we're doing the best that we can to serve the community. So those are some of the programs that we have to offer. If you have any questions, like I said, feel free to put them in the chat box. I'll put my email and our phone numbers in there, and feel free to email me directly. I know everyone's busy and email is often quicker and easier. You can call us to make a referral. You can email us to make a referral. You can email me directly if you have specific questions. You will receive emails between us that are secured. We want to make sure that security and safety of our members' information is very, very important. So it's really easy to pop in a password and set that up so that we can talk back and forth about any concerns that you have. Laura, thank you so much for a few minutes to talk about what we do.
Thank you, Carla. Appreciate it. Carla is a great resource for all of you who are out in the community and you see these individuals when they have issues and you know it's only going to get worse. We can help with that. We can make it so that they get the help they need now to prevent those troubles later. And that is what Lori Smith, our training coordinator, is going to talk about, because probably one of the biggest things that you see out in the community is falls among older adults. And it causes so many issues, not just falling down, but things later on. And Lori is our leader for our falls prevention programs. Lori?
Thank you, Laura. And thank you everybody for being here this Friday afternoon. We very, very much appreciate it. I wanted to first tell you a little bit about our falls prevention programs, and we have two of them that we offer to community members. They are both evidence-based workshops, which means they have been researched and they are continually evaluated to ensure their efficacy. And they are free for participants to attend, which is a really valuable resource for those in the community. The first workshop we have is called Matter of Balance, and it does have a little bit of exercise and movement incorporated into it, but most of what we look at is breaking what's called the fear of falling cycle. And what that is, if you're not familiar, is we've learned that if someone has a fear of falling or they've fallen very recently, then they can limit their movements and they maybe don't do things that they used to do that keep them physically active. And of course, we know in doing that, then you get even more socially isolated than you may even be now. You don't enjoy the activities that you used to, which can lead to depression, which can lead to, then you don't want to get up and be as physically active. Which can exacerbate pain. And if you have pain, then you don't want to move. And it just keeps going round and round. And all of those things can increase your risk of falls. So we look at breaking the fear of falling cycle at any point in that cycle. And we use different strategies to do that. We want to make sure people still feel confident in what their abilities are, but don't be so stubborn that you don't ask for the help that you need. We want to make sure that they are using any assistive devices correctly. We want to make sure that they are doing an evaluation of their homes to look at falls risks and various things to help them with that. It is a 6-week program, and we meet once a week for 2 hours each week. Our other falls prevention program that we will be moving into, it used to be Tai Chi, but it will be moving to Tai Chi Quan, is solely a movement-based program. It is 24 weeks long, and we meet twice a week for 1 hour each session. And again, it is solely a movement program. They learn 8 forms of Tai Chi Quan, and it helps to increase balance, flexibility, and strength. And it is very similar to the Tai Chi program that we had done in the past. And I can say in leading those classes, I've seen people during the program itself say they've noticed a marked improvement in their balance and in their strength. So it really does work. It's really fun to lead. Where we would ask you to come in is, as first responders, we know you are often going out to calls that have resulted from falls. And we know a lot of times you are seeing those calls repeatedly, for the same people. They're asking you to come out several times for falls. Some may result in transport to the hospital, sometimes not. Either way, we would love for you guys to share our information with them so we can help them before it becomes a larger health issue. If you're noticing these things as you're going out to the calls and you're noticing that they're falling repeatedly, just say, hey, we know of an organization that might be able to help you, that could get you this education, that could get you resources available to help you so this doesn't happen again. Of course, we want to be very careful of HIPAA violations, so you don't need to share anything directly with us. We do have postcards available that we can give you that as you're seeing these folks, you can give them. Has just a little bit of our information. We don't want to overwhelm them with information, just our name, asks, maybe we can help you, has our phone number and our website so that they can reach out to us then if they choose. But again, it's just that preventative measure. We want people to know us before really they need us. And it becomes, again, that larger health issue. So we would really love to help partner with that. We started to build that relationship before when we were doing these meetings with the first responders, and then this little thing called COVID happened and we had to pause these. So we definitely want to revisit that and really build that strong partnership with our first responders so that we can help each other do this fabulous job in serving these older adults. So I wanted to put that in the back of everybody's mind and how we can move that forward as well. So, and we can continue that conversation as we continue these meetings. So thank you.
Thanks, Lori. Fall's #1 indicator of somebody, having difficulty maybe in other areas, or, getting to that point where they're not having as much control over their own motion and those things. So Lori does a great job. She sees a lot of improvement after the classes. All right, so we're going to move on to our next thing, which is our panel discussion on older adults and reactions about COVID, the vaccinations, the isolation, all of those kinds of things. Older adults are really struggling and they're not really sure what to do. Is it safe to go to the store? Is it safe to see their kids? What do they need to do differently? And so we have a great panel today, who can give us some information about what they're seeing with the individuals in the field and ways that we can all work together and help them to overcome their fears and really get them some help and help alleviate the isolation that they may be feeling. We're going to start with Vinnie Deluca. He is with the community engagement team with the Green Fire Department. They have a wonderful community program in Green. Vinnie, please give us a little information on your program and what you're seeing.
Thank you, Laura. Thank you. So our program through the City of Green started at the beginning of 2020, and just as we all know, shortly got cut down due to COVID. We were in a position where, just due to our city regulations, the rules, we were not allowed to get into the homes like we normally would. We were not allowed to be doing the assessments and the visits with the patients that we normally would for most of 2020. A lot of what we were doing was being done kind of at the doorway, looking through the door, looking through windows, and trying our best to do assessments that way, which, as you can imagine, didn't work extremely well. We were still able to do a lot, but not really fully implement our program the way that it was designed to be implemented. So I took over the program at the beginning of this year, at the beginning of 2021. And since then have kind of gotten a little bit of the, the normalcy of our program back, being able to go into the homes and being able to do our assessments with our patients. We started to do it a little bit more at the end of 2020 and starting to ramp back up a little more now at the beginning of 2021. So some of the things were still limited just by some of the state regulations with regards to our nursing homes, not being able to really get into the nursing homes and see those patients yet. But yeah, we, essentially we get referrals from our paramedics who are on the ambulance running the calls. Just as Lori alluded to, the first responders that are out there running those calls, seeing those patients, getting their hands and their eyes on those patients, and realizing who it is that needs the help. So they make a referral to our community paramedic program. We then reach out to them and schedule one of our assessments. So I then go into the home and we do a few things. One, kind of a health assessment, take a set of vitals, do the basics. We talk about medical history, your allergies, some of those things, some of the medications that you take, as well as kind of a home safety inspection. So we're looking for things like trip hazards, fall risks. I'm looking for smoke detectors, carbon monoxide detectors, all of those things that are easily kind of accessible to folks to bring more safety into their homes. And then we do our kind of our report and then reach out to the direction home and make our referral. And then the direction home reaches out to that patient to kind of get the ball rolling with getting them whatever resources they may need. Grab bars, walkers, I mean, you name it, as far as the actual physical resources that are available. With regards to COVID, I've kind of seen two mind frames, if you will, and I think we're all kind of familiar with both of them just in our everyday lives. The first one being, this isn't a big deal, I'm not scared. And the second one being, this is extremely serious, I'm scared to death. And the first one, not so much that, me personally, I haven't seen so much of, I don't care, this isn't real, but I don't care because it's just the two of us or it's just me. I don't have any family and I don't go anywhere. So there's really no reason for me to be too worried about it, which is understandable, but still obviously want to educate them on some of the risks and some of the things, obviously their pre-existing conditions, if you will, just with being elderly and some of their medical history, that they are, a little easier, more susceptible to becoming or contracting COVID. The second one, just being scared to death. I can't see my family. I can't go to the grocery store. I can't go to church. I can't do those normal things that I normally do, which kind of leads into a couple of the new things that we have started doing here in 2021. And I don't mean to beat a dead horse here with the falls prevention, but obviously it is a huge thing that is extremely important for our elderly population. So we recently have partnered with Summit County Public Health on a grant. We've kind of signed a letter of partnership with them for some falls prevention and education things. So I have started to implement a falls prevention or falls assessment, risk assessment, as part of my assessment in the house, using the STEADY program. And then the second being, kind of a depression screening. A lot of the patients that I see have been talking a lot about, feeling anxious and feeling depressed and not being able to see their family, not being able to see their loved ones. So part of what I have started to implement is kind of a depression screening, just ask some basic questions. And then based on the answer to those two questions, about depression, about anxiety, we then can have that patient make a referral to their primary care physician, based on the findings of those assessments. So, and then with regards to the falls, the patients that typically are able to get out of the home and able to go and do the things that they normally do, the grocery shopping, go to church, that may be an extra, a few thousand steps as a trip to the grocery store that these patients aren't getting anymore. They're kind of stuck in their homes and unable to do those exercises. So really important, the fall prevention stuff and getting these patients some access to some information and education on different exercises and things that they can be doing in their homes. And then the last thing is that we're trying to work through right now, and we're trying hopefully it will become more accessible to us as the vaccination becomes easier to handle with regards to how you store it, how you transport it, is an outreach program to get our patients in Green who are homebound access to vaccinations, and hopefully the ability to be able to do that in their home. So that's just a couple of the things that we have started to kind of implement here over the past few months because of COVID. Kind of the things that we thought were important and are kind of attacking with our patients. So thank you.
Great, thanks, Vinnie. Next, we're going to hear from Brenna Herman. She is with the Akron Metropolitan Housing Association. She works with all of the senior housing buildings. So she sees a lot of individuals in the same realm as Direction Home. And we really appreciate you being here, Brenna.
Thank you. And I actually got myself unmuted, so good. I'd like to say happy Friday, everyone. I'm so glad it's Friday. And I just always think back to this time last year. It was crazy and we knew it was, but little did we know how our lives would change and how we had to adapt and keep adapting. So thank you for our resilience, right? We'll just keep working along. So AMHA, I'll just do the quick 101 on AMHA. We're low-income housing for residents in Summit County. We have about 30,000 individuals who live under our different housing programs. So we have our public housing program, which is low-income public housing, and that consists of family developments and senior and disabled high rises. And that is where AMHA is the landlord. Residents are paying AMHA for rent. Then we have another large housing program, which is Housing Choice Voucher, formerly known as Section 8 program. And that's again about another 5,500 families that live under that program. And that's where we partner with landlords to provide subsidy and also include some permanent supportive housing and all different housing programs. Obviously, under Housing Choice Voucher, an individual is paying a landlord. So, and then we have another housing program, which is kind of just all in one, just different kinds of contracts through tax credits. And it could be like Hope 6 properties, Edgewood Village, Cascade Village, Wilbeth Arlington, properties that have a separate HUD contract. So to say all that is we have lots of wait lists. There's probably about 20,000 people that are on our wait list. Yes. Wow. I saw Sam's wow. Okay. But so we are, our website has information for applying online, and I put in our contact information in the chat completely the second time I did it. But basically with our housing, it's all on point systems, and people apply, and you can apply for as many different kinds of housing. There's nothing that's fast. We don't have emergency housing. Everything is based on points. So if you're a veteran, you get a point. If you're couch surfing or paying more than 50% of your income for rent, that gives you points to move up on the list. So, so yes, it can be confusing, and yes, it can be a long wait. So our housing, of course, are basically with what we do to maintain our properties and for the voucher program, keeping things running. And then within AMHA, we're in resident services. I'm, again, Brenna Herman, resident services senior manager. So I oversee the family programs and seniors with the focus on seniors, which is why I'm here today. But basically, COVID has changed, like as with everyone else, lots. So we are really trying to outreach to the residents through our website. It's really helped us have to change some processes and procedures for people paying rent online. How do you do paperwork? Because we're not doing individual appointments. So just as not being able to go into homes and do assessments, we're very limited, but we've adapted and moving ahead. So what we have seen with COVID, of course, is just like Vinnie was saying, it's a whole gamut of between I'm just keeping to myself and to the other extreme of not, being afraid to open the door. So our response has been really to provide a lot of information on our website, a lot of information in our high rises, posting information. And I can just say right off the top, our community partners have saved us, as always, really working to provide resources, whether it's information, mask resources about what we can do, and the fun stuff. So we have had senior food boxes delivered, of course, with the help of Direction Home, Summit County Job and Family Services, a few volunteers that have helped. And we've really focused on getting information door to door, which again is not easy. Our biggest struggle, I think, has been just trying to help people with isolation. I know that we've had many webinars and stuff that for people with mental health, this pandemic has really has been an eye-opener for some, that people with mental health who isolate typically are really being subjected to even more isolation than before. So we're really trying to figure out what we can do for programming. And since we can't do one-on-one programming like we had done before, just trying to work to assess how we can meet our residents, what kind of connectivity they have. So our next phase has really been assessing connectivity issues, working with Direction Home on the whole staying connected. I can't think of the name of it. Stay connected at home. Got it. I have it hanging up on my wall. But really trying to look at what we need to do for virtual programming. We know a lot of people have smartphones, but they may not do anything besides make a call or check Facebook. So, getting over the whole process of being on Zoom or virtual programming is difficult. So that's really our focus right now. Of course, we have all our processes and procedures about when someone's positive, how do we post it? How do we let people know precautions? So we have internally those things instituted, but it's really just having our resident services information lines. So if we can have referrals, or if people need something in particular, we're making those connections. So we've always had a process of request for services, meaning how do we know what needs people have. We can do internal or external referrals to help us make connections with agencies and make sure that they're calling Direction Home now before they are in a crisis. So we continue to work on that. Also just looking at with telehealth and with Vantage Aging, with their telehealth programs, trying to look at what we can do to really outreach to the residents and move ahead. So really connectivity, and what do we do now that we can't meet one-on-one, and it's going to be a long time before we could do small groups. Sorry, I thought that was dead. So and then the other thing is that we're really working on is the vaccines, and we had a vaccine clinic yesterday at Fowler 1 and Fowler 2. So that was very successful, and we appreciate Direction Home working with us on that. About 111 people were vaccinated. So we were excited for that. And we're also really just working on what other buildings we can do. We've been very appreciative of Summit County Public Health also reaching out to underserved minority populations, and us trying to focus on our outreach to make sure they're aware and know about where to get vaccines, how do you do it, and making sure we're giving information. So that's kind of my spiel on what we're doing. Again, I know we're going to have more questions, but I'm always happy to hear from you, and let me know what we can do to help. Again, we're always looking at pilot projects that we can see how things work to help expand services for our residents. So thank you.
Thank you, Brenna. And next up, we are going to have Sam Mccoy. He is the Senior Vice President of Elder Rights with Direction Home. He's the guy who works with all of the ombudsmen, people who advocate for the rights of individuals in nursing facilities, etc. Sam Mccoy.
Thank you, Laura. It's nice to be here this afternoon. You know, I was flattered to be invited to the first responders group. And I thought to myself, how on earth do I fit in with a group of first responders? And it took me a minute to realize that many times the advocates in this department, in the Elder Rights Department, are the first to know or the first to be contacted about rights issues in long-term care facilities, mistreatment, whatever the problems may be. We're often the first, the first group that is identified or contacted because of our presence in these facilities. But then I also realized that first responders are in nursing homes a lot. I know that residents and families call EMS, police, fire, others all the time for issues large and issues small. And we gratefully we rely on you, on the first responders, for the emergency care and the immediate response in critical situations that you provide. So our worlds really do interact in some ways. We are in, the ombudsman advocates are in over 400 nursing homes, assisted living, and adult group homes in a region that goes beyond our 4 counties here that Direction Home is typically in. And we typically respond to every kind of complaint that that you might imagine. If you've had family members, friends, or others, or maybe you've been in a long-term care facility receiving therapy yourself, you know that the level of concerns can run the gamut from response to call lights to much more serious concerns, abuse, neglect, exploitation kinds of situations. And I want to leave you with the thought that when you encounter, as first responders, family members, leaders in the community, when you encounter families, friends, others, professionally or personally, who are having concerns, problems, complaints about long-term care, consider calling us. We follow, and that is Direction Home and the Long-Term Care Ombudsman Program. And, we follow a number of principles of confidentiality, of course. I don't rat people out for calling me. Your name won't be, as a complainant, won't be exposed unless you give us that authority. We always follow a client's direction, a consumer's direction, and work toward a goal that they can identify and articulate. And we're always honoring that individual consumer or that client's right to make independent decisions on their own. Those are hallmarks of all that we do as advocates. Certainly, the presence of COVID in our facilities in the last 12 months has turned our world upside down. It's been horrific in my mind, and just an unbelievable disruption of the lives of our seniors and their families, and also of a disruption in our work. As Vinnie mentioned, so much of our work within the facilities has been put on hiatus. We are doing infrequent visits within on-site visits to facilities. We've been doing, window visits. We've been doing, virtual visits with electronic devices, laptops, tablets, and that sort of thing. But it's not the same, as you all know. It's not the same as being there, and we believe, and my friends from Direction Home hear me say this all the time, that we believe in being there means better care. Just simply having an advocate, whether it's a professional advocate from Direction Home, whether it's a family member, a friend, or other, within the 4 doors or 2 doors of a nursing home, it is, it's essential to be there, to see what's going on, to observe, to interact with clients and residents on a one-to-one basis. A couple of trends that we've seen during the COVID era here that are concerning to me and have come to light in a number of circumstances are that we're seeing, of course, many more complaints about visitation. Families are desperate to be able to get in the facility and visit with someone they love. I don't blame them. I'm there too. I don't blame them. We need to see our facilities be understanding and work with families to allow what we call compassionate care visits. And compassionate care visits are permitted in every facility in the state of Ohio, regardless of what color your county is, regardless of your COVID, the presence of COVID in your facility, regardless of any circumstances. Folks need to understand that a compassionate care visit is not limited to an end-of-life situation. So we are every day, multiple times a day, advocating on behalf of families and residents to find a way to allow some degree of visitation. That's been the number one uptick in our complaint work in the last 12 months. Secondly, and maybe more concerning, is an increase in a category of complaints that we see as being categorized as dignity and respect. And that means our residents in long-term care facilities are not being treated with the dignity and respect that they deserve and their family has come to expect. And that's concerning to me. These incidents of dignity and respect violations, they don't gravitate to a level of abuse. But they can, and that's my concern, that those types of interactions, those responses from caregivers, that are the snippy, snappy comeback, the demeaning comments, those types of interactions can devolve into a more physical or verbal abusive type of situation, and that concerns me. We are continue to maintain a presence in our facilities virtually. Thankfully, we have resident lists, family member lists in our facilities, and we've been going through those lists, calling families, calling residents, independently at facilities to try to get a sense what's going on in there. I think this is going to lift. Thankfully, we know that COVID in the nursing homes across the nation has dropped, significantly here in the last several weeks, and we're grateful to have a vaccine that's being accepted at a high degree by residents. I'd like to see it more accepted by caregivers, and I think we will get there ultimately. But despite the presence of COVID, our role as advocates has continued and will continue as we move forward out of this situation. So that's a bit about us. Just like Carla had mentioned, we wouldn't expect you to sort out the degree of complaint, the severity of a complaint. If you're in a facility as a responder, family member, or others, or you hear comments or observations that raise your eyebrows and make you wonder, give me a tip. Give me a tip. We'll follow up on it, and we're happy to do that, because that's what we do as advocates. So thanks for your time. Thanks for your interest. Be glad to respond to questions a little later in the presentation.
Thank you, Sam. Actually, I think that Brenna just posted a question for you in the chat. Question for Sam about timing of hopefully visitation rules lifting for assisted living and nursing homes.
I wish I knew, Brenna. I wish I knew. I think we're getting there. We're seeing the governor issue a variety of different orders here. Sporting events, a variety of different things are beginning to open up. I think I'd like to think by first part of May, mid-May, we'll see visitation, for face-to-face visitation being much more commonplace in our region. So sure hope so.
Fantastic. I have a question for Brenna. What do you think the acceptance of getting a vaccine, of getting vaccinated is among the seniors in your housing facilities?
We've had a pretty good response. We always figure for most things when we do something, 50% of the eligible people, if we get 50%, we'd be really happy. And so we see a little bit less than that with the age group, that the 65 and plus, but some of it is that they had already gotten a vaccine. So that was good. So that means some of the outreach and connections were made. I think it's more, I'm not seeing a huge resistance. Some of them are more, residents are saying, I'd just kind of wait a little bit, or they just have to really think about it. And when it's offered, then it's a reality. So they're much more open to go ahead and have it. When it comes to you, it's a lot more of a incentive, I think, to think, oh, this is pretty easy. That would be a good thing for me. So, and support from the family. It's the same, whole gamut of, no way, or I had a really bad reaction to a shingles vaccine, so I don't want to, take any chances. But it's been pretty positive.
Great, thanks, Brenna. Sam, I have a question for you about staffing in the nursing facilities. I know that there, especially at the beginning, there was a large amount of staff in the facilities that was contracting COVID, and it really affected how they were able to care for the residents. Is that something that is still continuing?
Laura, the staffing issue in long-term care facilities, nursing homes, assisted livings, and even in the home care realm, is going to be with us. It's a feature and a result of demographics that aren't in our favor, working in our favor here. Yeah, we still see staffing related issues come to our attention in long-term care facilities. And I will agree, as you mentioned, they're not as significant, the staffing issues and I'll call them a staffing crisis in individual nursing homes. That's not as prevalent by far as it was during the early part of October and late in the summer. You may recall at that time we had the Ohio National Guard being called into facilities to staff up. I think facilities have broadened their net, if you will, to include agencies across the region. I mean, agency staff to pay and recruit additional staff in their facilities. I know facilities have been paying bonuses. I know facilities are paying giving perks and benefits for additional for staff who work additional shifts, additional days. But I think what that does is some of that really begins to compound some of the care issues that I spoke of the dignity and respect. Think if you've got a caregiver who is a parent who has children in the home who are not in school or being homeschooled or schooled virtually, who has worked the last 13 days straight at the nursing home. And I think that's a recipe for some disaster when they're working with a dementia patient or a patient who is not uncooperative and is resistant to care. But in general, again, I think the workforce issues are going to be with us. Thankfully, I think the immediate crisis is over. Facilities have been really resourceful in finding additional staff available, training additional staff, but it's going to be a problem for a long time.
Thank you. Vinnie, if I may ask you, have you found a lot of resistance from individuals afraid to go to the hospital? Say they did fall and they need to go to the hospital. Are they afraid to go to the hospital because of COVID?
I don't think we're seeing that as much anymore as we were last year in the summer and fall. We really had a big drop off in our call volume last summer, July, August, September, around that time of the year, where we were basically just not running as many calls as we're used to. And I mean, if we can contribute that to folks not wanting to go to the hospital, being afraid of going to the hospital, I think that's reasonable, but we're not seeing that as much anymore. We've pretty much gotten back to our normal call volume, a lot of which I know we talked about the nursing homes being nursing home calls, and a lot of those nursing home calls being for falls. But at this point, we've kind of just been instructed. We have excess supply of surgical masks on our squads, and as soon as we come in contact with a patient, we ask them if we can place a surgical mask on them. I have not personally seen anyone decline that, and then we just do our best to ensure them that we're going to keep them separated from anybody coming in contact with any other patients at the hospital, and do our best to get them, transition from our ambulance into whatever room we may be going into as fast as possible.
Thank you. How about the rest of you? Are you seeing some of that? Please share in the chat, what you're seeing. I want to open it up to the audience now. do you have any questions for our panelists?
I was just gonna say, this is Bonnie Stitch. In Stark County, the squads did exactly what Vinnie said. We had a huge drop in call volume all the way around. And quite frankly, it was some of the patients that never should be using EMS to begin with, quit using it. And then that picked back up, as he said. And then we had a time frame, and maybe he saw the same thing, is that when testing became available at all, then patients would want to get tested even if they didn't have symptoms. They just thought it was like, I'm going to go get tested. So they'd ask somebody and they would say, well, go to the hospital. So they'd call the ambulance. They'd call 911 to actually get a ride to go to the hospital, and all they want to do is get tested. So the squad would arrive, thinking possible emergency, and then that's all they had. So there's been quite a big revamping of the protocol, if you will, to be able to allow the medics to advise patients, which normally we wouldn't teach them and then sign them off and leave. But now we've gotten to a point where we've had to say, perhaps you don't need to go for that reason, or you could go here or there. And then having to have those resources available has been a challenge, because that's just one more thing to deal with when you're trying to do response. But
Yeah.
it's been up and down with all kinds of different versions of that all year. But now I think it's kind of settling back to old normalcy. I think that's what Vinnie was describing too. So.
Yeah. I think we've seen both ends of the spectrum. We've seen many patients who they need to go to the hospital and are afraid to, they don't want to. But we've also seen, I personally have been called to a patient's home because he thinks he had an exposure to COVID.
Mm-hmm.
No symptoms, feels fine, but I think I was exposed. So we've seen really both sides of the story with regards to how people are reacting to it.
I have to unmute myself. Carla, would that be something that ADRC could assist with, for the transportation companies? Would that be something that we could help with?
That's exactly what I was just thinking. Transportation is one of our biggest requests. And we do have a lot of resources. Sometimes there's resources available to people and they didn't even know that they were available to them. So absolutely, call in, tell us what they have going on. Can they get to the doctor? Can they get to the food banks? Can they get to the grocery store? And we can look up what insurance they have, what type of program that they're on, and whether transportation is available or not.
Thank you. Anyone else have a question for someone on the panel?
I have a question. In Hartville, we've had several cases where we've had caregivers who've been infected with COVID taking care of a older person. So we didn't know what to do with the older person who does not have COVID or symptoms.
Donna Barrett. Donna is our representative from Summit County Public Health. Donna, are you on the call? I don't think so. All right. Carla.
I can jump in a little bit while we're waiting on Donna. So a lot of times it's asking the person who's ill, the caregiver, what is your backup plan when you're unable to care for your mom? Who helps you? Is it a neighbor? Is it a friend? Most people have some form of an informal support for a backup, but it's tough because here you're at a critical point. The paramedics have been called, and oftentimes that they're not well enough to share that information. So that is a tough time. We have had some of our people transported to the hospital with their caregiver until more investigation can be done. It's definitely a problem, and everybody that calls in, we're always asking them, who cares for you now? If your daughter gets sick, if your son gets sick, what is the backup plan? What would you do? Who would help you? How would you call 911? Who would stay with you? even if they don't have a backup plan at that point in time, we want to plant that idea and start talking about it and make them start thinking about it. But yeah, it's difficult, John. It's what do we do when we get there and you have to take the daughter and mom is still home alone? Is she competent? Can she stay? It's a problem for sure.
You know, John, back in the day, pre-COVID, there was sometimes an opportunity for a short-term respite stay in long-term care, in a long-term care facility. And, you know, the admission process and the concerns of bringing COVID into the building are such that that's almost disappeared. And that's a problem. And, you know, as Carla said about folks need to think ahead and think of a backup plan. You know, many of us don't even think we're going to get old, let alone the backup plan. You know, it's a tough, you know, it's a tough kind of perspective to get people to consider. But ideally, that backup plan, you know, should be in place and should be known to you know, to first responders and family members and others. But I know that it's not. It's just not there. It's just not there.
Thank you. Are there any other questions?
I didn't have a question. I just, if there's something to add, if it's okay.
Please.
You know, one of the things that I think it just is a decent insight to where our patients, at least the patients that I've come in contact with, where they are at mentally. You know, I go into their home and do an assessment, and of all the things that we are able to do for and get for our patients, from the life alert to grab bars to, I mean, the array of physical resources that we're able to get them. The thing that I have seen, and it's really kind of neat to see, is how excited they get when I tell them, I'm just going to be a familiar face. I'm going to be, this isn't going to be the only time you see me. Even after we get you the resources that you need, I still would like to stop by once a month, every few weeks, and just sit down and chat. And that is the thing that makes these folks' eyes light up. The thing that they really, really are in need of and are really longing for is just that contact with someone. And I mean, I show up being a complete stranger to these folks, and after an hour with them, they're inviting me to come back because they just want somebody to sit and talk with. So I just, that was very eye-opening to me, and it was something that I think is extremely important for myself and for everybody to understand. What we're doing for these folks is it's so much more than just the physical resources that we're getting for them.
Thank you, Vinnie. Who else? All right, well, we've gone a little bit over our hour, but I think it was definitely worth it. Thank you so much. You have any questions that you would like to pose to the group, or, you know, to one of the panelists, one of the presenters, please send it on to me and we'll get that answered for you. In the meantime, stay safe. Thank you for keeping us safe, and have a wonderful weekend.
Yes.
Thank you.
Thank you.
Thanks, everybody. Take care.
Thank you.
Thank you, Laura.
Thank you, Sam. Thanks, Vinnie and Brenna. You guys were great.
Yep.
Laura, thanks so much for having me. I appreciate it.
Absolutely. Stop
All right,
it
take care.
anytime.
Will do. I appreciate it. Thank you.
Take care.
Bye-bye.